Let me just check online real quick. And Dr. Wynn's not here yet either. Terry Coyles. 1, 2, 3, 4, 5.
Good morning.
Good morning, Terry. Is that Dr.?
Hi, Chad. I'm here.
Is that Dr. Wynn?
Yes, hi there.
Okay, and Dr. Wynn. Okay. Yeah, we're good.
Good morning, everyone. This is the Mojave County Board of Health meeting. Today is April the 22nd, 2024. I'd like to have the clerk do a roll call, please.
I'm here.
Chairman Bishop? Oh, you're here. Sorry.
I am here.
Okay, Hunter Adams? Here. Terry Coyle? Or Coyle?
Present. Present.
Thank you. Byron Stewart?
Present.
Robert Litz?
Present.
Nancy
Monjo.
Monjo?
She won't be here.
Okay. Cal Sheehy? Sandra Thomas? Dr. Wynn?
I'm here.
Okay. And Dr. Kingsley? We have
Present.
a quorum.
Thank you.
Okay, it sounds like we do have a quorum. If everyone will please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll begin this morning with the call of the public. Madam Clerk, do we have anyone wishing to speak?
Not at this time.
Okay, I will close the call of the public then and go on to our presentations from the Mojave County Department of Public Health Police Initiative Program by Brenda LeBoud, the Division Manager. Morning.
Good morning, members of the Board of Health. Actually, this presentation is going to be by Sarah Hancock, who's the program coordinator for the HAPPY program, Healthy Arizona Policy Initiative.
All right. Whoops. Okay. Let's hope that that's the right presenter mode. Good morning, everyone. My name is Sarah Hancock. I'm the program coordinator for the Health in Arizona Policy Initiative program. It's one of two programs that I oversee for the health department, the other one being Arizona Health Zone, which I've had the opportunity to speak to you all about before. So today's presentation is going to be pretty brief. We're just going to go over in general what HAPPY is, what we do, how we're funded, and then we'll have an opportunity for questions at the end. So HAPPY is the acronym that stands for that Health in Arizona Policy Initiative. I think it's one of the coolest acronyms in the health department for programs, but I think I'm biased. Basically, in a nutshell, our program aims to combat the 4 leading causes of chronic disease deaths in Arizona. So those were reported by the CDC at the start of this program being created. And those 4 diseases that we focus our attentions on are cancer, Alzheimer's, chronic lower respiratory disease, and also heart disease. So HAPPY also exists within the department as part of a larger block grant called the Healthy People, Healthy Communities grant. It entails 6 grants in total, HAPPY being one of those 6. So the activities of the HAPPY program are really designed to reduce the incidence and prevalence of those 4 diseases. One of the interesting things about HAPPY is that our target population is all Arizonans. So sometimes some of the other grant programs have different target populations that try and carve out one specific piece of the Mojave County population. HAPPY is a little bit different in that we can work with anybody because anybody can experience these diseases later in their life. So HAPPY has 2 main funding sources. One of those funding sources is called Proposition 303. Basically, it's money that's taken back when tobacco products are sold. The tax on those tobacco products, a piece of that pie goes to prevention measures, and HAPPY is one of the grants that's funded by those taxes. The other piece of HAPPY funding comes from WIC health lottery funds. So the lottery funds a couple of different health initiatives. WIC is one of those, and then HAPPY kind of tucks underneath WIC in that we serve WIC participants and their families. So our focus areas for HAPPY are pretty broad. We can work in any of the areas that you see listed here. So we can focus on school health. We can look at community design and healthy communities. We can work on healthy work sites through the HOP program. We can work on chronic disease in general. We can look at healthy aging, clinical care practices, and also procurement are some of the focus areas that we could focus on kind of under the umbrella of HAPPY. What we actually do here, the word just escaped me right now, I'm sorry. The work plan that we have for this year that we created actually has 5 different goals. The first goal that we set for ourselves is to create and begin facilitating a self-measured blood pressure class. So we partner with the Bullhead City Library, and we go there monthly when they have space, when they have capacity in their rooms, and we host educational sessions that are aimed to have community members learn how to take their blood pressure on their own, with the idea that they will log those blood pressures over time and show them to their primary healthcare provider so they can get a more accurate feeling of what their blood pressure is across many different readings rather than only when they're in the provider's office. We also provide a chronic disease self-management class. So it's a 6-session class. Each of the sessions is 2.5 hours. And it goes over a bunch of different topics really designed to help people that are suffering from different chronic diseases learn how to cope with that in their life. So we talk about different things like fatigue, medication management, communicating with your primary healthcare provider, things of that nature. We also facilitate Tai Chi for arthritis and falls prevention classes. So I was certified to teach Tai Chi classes in this specific modality through the Tai Chi for Health Institute. We facilitated our first series in the January-February timeframe at the Kingman Library, and it was very well received. We had about 33 people show up to the first class, and we had about 26 people at the last class. So it was pretty well attended. We had enough people say that they liked the class that went back to the Kingman Library and asked for it to continue, that the library invited us back to participate in June. So we're going to be facilitating another class. We're also toying with the idea of what this might look like offered at different work sites. So possibly working with the city of Kingman in like a lunch and learn type setting so that they could offer this to their employees as a health promoting measure. We also provide a monthly staff newsletter. I have a little snapshot of one of the ones that we produce here. The staff newsletter has a couple of different elements that are recurring in each one, but as it fits under this program, we always have a health promotion message. So that changes month by month. Some months it's the monthly health observance. So like for Lung Cancer Awareness Month or something, we might have information in the newsletter on that. We also have other department-specific information. And then we also facilitate sun safety classes at some of our early childhood sites. So working with young kiddos and teaching them about the benefits of sun safety and kind of how to prevent skin cancer and that type of a situation. So those are the 5 goals that we have in our work plan for this year. For HAPPY, as well as for our other program, we do try to keep in mind and try to have a PSE lens. So PSE stands for Policy, Systems, and Environment. This is the idea that while it is good and beneficial to provide individual education or one-on-one education, you can really help make sure that those healthy behaviors that you're teaching are easier for people to adopt if you can make the environment in which they live conducive to that health behavior. So for an example, if we're trying to teach folks the benefits of being physically active, yes, having a one-on-one education class with them about the benefits of physical activity is important, but also making sure that when they go home or when they go to work or when they go to the other systems in which they engage, that they have the ability to be physically active and put those things that we've taught them into practice. So do they have access to parks in their area that they feel safe and comfortable accessing? Do they have breaks at their work site that they can go and walk or be physically active? things of that nature. So we're trying to make sure that the healthy choice that we're encouraging them to make is easy and applicable in their life once they leave class. So when and where we can, we try to make sure that the interventions that we design have an element of this in there, or at least we're thinking about this when we start thinking about sustainability efforts of some of the things that we put into practice. So one of my favorite things about the HAPPY program is that it has a lot of flexibility built into its work plan. So since I'm only one person, I'm the only person that works in this program, and I only work in this program part-time, I really think about this as how can we be most effective in utilizing our resources? And in my opinion, the most effective way to do that is to plug holes in other existing organizations. By that I mean, as an example, we were approached by WACOG for this year's action plan. They said, hey, we really need some Tai Chi facilitators. Is there any way anybody in the health department can pick that up to provide that service? So we helped to fill that gap in that organization through Happy Time. So rather than trying to build things from the floor up with very limited capacity, instead we focus on helping other organizations maximize their resources in the focus areas that we work on. So with that in mind, we will start thinking about the work plan for FY25 in the June and July timeframe. If anybody has an organization that they work with that has a need for something that fits one of those focus areas, and they just need a little bit of extra manpower or other resources, you can always reach out to me, and we can explore ways that we might be able to help those organizations in our upcoming work plan. Again, it's very, very flexible. As long as it relates back to any of those focus areas that we talked about on the previous slide, we can figure out a way to make it work. I know that was super brief, but I'm open to any specific questions that anybody may have about the HAPPY program.
Thank you for that presentation. I do have a couple questions.
Sure.
What is chronic lower respiratory disease? Is there a higher level and a lower level?
So I believe that chronic lower respiratory disease encompasses a couple of different diseases in the same way that heart disease kind of has a couple diseases underneath it. But I guess I would say it's chronic in the sense that you kind of live with it for the majority of your life. It's kind of a treatment rather than a cure type situation. But the CDC identified that as one of the top leading causes of death in Arizona for this grant cycle.
So the lower is the seriousness of it. It's not the position of the disease itself on your body.
That's a good question. I honestly don't know how I would articulate it for sure. I'd have to come back to you for that.
Because my first thought when you said that was, is there...
I can answer that question.
Oh.
Yes, go ahead. I look forward to your answer.
Yes, hi. I'm glad you would bring up this topic, and I appreciate your presentation. Lower respiratory disease like COPD. COPD and CHF is #1 in chronic illness management. And I actually, matter of fact, last month I chat with a program, try to bring that to our community. It's a hybrid model for patient education via virtual, via device. They have a pulse oximetry, just like measure oxygen up the finger, and then blood pressure and weight management. So it's actually recording, just like what you described there, using blood pressure management, and have that for our patient to provide a hybrid model between, the patient don't have to come to see a physician in the office to have data to discuss with the physician. So lower respiratory infection, lower respiratory disease is COPD, emphysema, chronic bronchitis. Those are the major conditions that belong to the chronic illness. And if you look up, it's cost the health system tremendous amount of money and funding. However, mortality is really high. So, and the treatment is pretty simple, pretty straightforward, continuum management. So to be along that side, I love what you described there in terms of education. Our county is large, so it's a lot of time patient might benefit from a hybrid model. What that is a virtual visit. We actually have pulmonary virtual visit for pulmonary rehab now that available and reimbursed by insurance company. So I want to share that with you. Any other question or concern, I'm happy to answer.
Okay, thank you very much. Another question I had is Tai Chi.
Tai Chi?
Sure,
Yep.
Tai Chi. Probably everybody knows what that is, except me. Do you have a video showing what this is that you can put out on social media so that people like me can see it's not something, it's not karate or anything
Right,
like that.
right.
It's more of an exercise kind of?
Yeah,
I'm
so
think-
the Tai Chi for Health Institute does have a couple of different videos that they've put together to kind of explain the process. They have different Tai Chi series for different health conditions. The one that we facilitate specifically is focused on arthritis and falls prevention. So it's theoretically within the martial arts family, but it's definitely not like kung fu or something like that, right? So it's a lot slower. It's almost more like a stretch than it is like a cardiovascular exercise or something like that. So it's not really going to get your heart rate up as something like that might do. Instead, we focus on very like intentional movements, long, slow movements, not extending your joints fully for that arthritis protection. And then also weight transfer is very important. That's the falls prevention piece. So being very intentional of where you place your weight before you make any movements, it just kind of gets folks in the mindset of thinking that way. And as they practice more and more, they kind of train their body to think that way. And that's where the falls prevention comes in. So it kind of retrains your brain to be more conscious of transferring your weight before you make a movement. And that can help prevent unintended falls.
Okay, yeah, I would like to see some more education on that for
Yeah,
for people
absolutely.
like me that really don't have a clue, and it sounds like a class I need to send my dogs to. Maybe they wouldn't jump on me and make me lose my balance as much if they were aware. And then, speaking of dogs, have you considered the possibility of putting together a program where people could go to our animal shelter and maybe walk a dog as part of their program for balance and physical exercise, the dog size depending on the person?
I haven't. It is a good idea, though, especially as it's promoting physical activity, which has health benefits regardless of what type of physical activity that you're doing. That would be a good one, too, in that it would help the animal shelter. It's something that we can keep in mind and maybe reach out to them about and see if you maybe even do like a walking program where folks come, they walk a dog for a certain length of time, and then they can record, I did a mile loop or something, and they can record that even through the county, maybe as part of our health and wellness coalition and programs that they offer.
Yeah, especially with the new shelter that we're going to be cutting the ribbon on May 6th. It's a beautiful facility, and I know there are some shelters in other cities and states,
Right.
and they actually charge a fee or they accept a donation to walk a dog, and then they use that money to further the care and the medical needs of shelter dogs. So,
That's awesome. That's a good idea. Thank you.
okay. Any questions from any of the board members? Yes, go ahead.
I have one. I was just wondering which classes, if any, are offered in a hybrid model, or is it all here locally in Kingman?
Yeah, so we can actually offer the Tai Chi classes as well as the chronic disease self-management program virtually. There's just a few little tweaks that we make in order to make that possible, but we could definitely offer it up in Colorado City if you guys had a need. Absolutely.
Any questions from anyone online? Sarah, thank you very much for your presentation and for answering my silly questions.
Absolutely. Thank you, everyone.
Thank you. Okay, we have another presentation from the Mojave County Department of Public Health Tobacco Cessation Program by Brenda. Just so you know, I smoked for 10 years and I quit 39 years ago, so
Oh, that's wonderful. That's
Yeah.
wonderful. Congratulations. Yeah, that's quite an accomplishment.
yeah, my biggest accomplishment in life. I'm very proud of that, 1985.
And you should be. Absolutely. That's a tremendous accomplishment. I am going to introduce another one of my staff members. It's not me today speaking. I apologize. But her name is Kelsey King, and she is the program coordinator for the Mojave County Tobacco Use Prevention Program. So, Kelsey, if you want to come down.
Hi, thank you. So I don't have a visual presentation today. I'm just going to talk to you guys. I am the program coordinator for the Tobacco Use Prevention Program. A little bit of what I do is I have prevention education for the youth in Mojave County. We have cessation services for anybody 13 and older in Mojave County. And then we also work with businesses to help them better understand and better regulate so that tobacco doesn't end up into underage users' hands. The one thing that I was asked to present to you guys today was the Ashline. Ashline is the statewide quitline service. It is completely free to all residents of Arizona. Again, anybody the age 13 and up. They have 4 separate programs for people that they have identified have certain nuances that might make it harder for them to quit. So there are certain programs to further help people who are youth, pregnant, postpartum, people with mental health or behavioral health issues, and then also the Native American population as well. It is, again, completely free to any Arizona residents. They do have coaching by phone. And then they also offer nicotine replacement therapies for free up to 8 weeks delivered to the residents of the person who's trying to quit. They offer free patches, lozenges, or gum. They also work with healthcare providers that are helping these patients to obtain access to higher drugs such as varenicline or bupropion to also assist them to quit smoking. They also have digital services, so if people need just a quick motivational message by texting, they can. They also have little videos that help show people how to cope getting through cravings or withdrawals. And then this service is open 24 hours a day, 7 days a week. They are only closed 2 days a year, that is Thanksgiving Day and Christmas Day. So at any point in time, if someone were to call into them, they are gonna get a live person. Same thing with the texting, it's always gonna be a live person. So that pretty much wraps it up. If you have any questions for me, just let me know.
Okay, thank you very much for that presentation. Any board members have any questions? Anyone online have any questions? You get off easy. Thank you, Kelsey.
All right, thank you.
That was, and just on that point, just like, it was released in a press release to the media for that, so that number will be put out there, and it's on our social media too. I also want to recognize that Mayor Kalshihi is online. Thank you.
Morning, Cal.
Thank you.
Good morning.
Okay. So we'll move on to the official business to come before the board, and that's going to start with the Public Health Director's report.
Thank you. Good morning. Just a few things to upload that have occurred. Just want to recognize Mojave County Department of Public Health, WIC. They met their caseload, and for 3 months they met 100% of it. So for that, they were awarded an extra $10,000 in funding for the next fiscal year, and they've accepted their caseload for this next year. We are also currently working with Coconino. Previously, for the past several years, Coconino has managed Colorado City's WIC caseload up there. We're working towards over the next 2 years to transition those caseloads back into Mojave County Department of Public Health, and so that they're managed there, so that we have a better interaction with those community members that are WIC services, they're provided WIC services, and be able to better integrate and meet those needs for the community there. So we're working towards that, but it should beginning to be able, Coconino, we're working with them to be able to provide a space for them where our current facilities are at. And so that WIC services, right now, Coconino drives in and they have a temporary place and it's not offered every day. So we would be moving towards being able to offer those services as the same type of hours that we offer here in Kingman, Lake Havasu, and Bullhead City. The typical Monday 8 to 5, so just be able to, so we're working towards that. But just want to commend the WIC staff and their amazing work that they've been able to do over the last year and accomplish for those citizens of Mojave County that do use the WIC services, especially for those mothers and children. Just want to provide a quick update on the Q3 of the mobile unit. So they have testing, they have 99 health screen performed, they have done 165 patient visits in over January, February, March, and areas served have been Chloride, Dolan Springs, Kingman, Meadview, White Hills, Wickiup, Yucca, and Golden Valley. Just want to add, they're doing amazing work now, and so it's, it takes a good year for that mobile unit to really get known in the community, but they are there present, and a lot of people are recognizing that and having a lot of great success there, and especially on those health screenings. A lot of high blood pressure and other points have been identified, and working to connect those individuals with proper access. So just doing some, want to recognize staff there. Just want to put on, so currently, right now, the state for vital records is going through a rule process that will be increasing fees. Vital records is, all funding is through fees on this process, so increase will be coming for individuals within the county across the whole state. Working with the other health directors with this process, there is a certain percentage that each county gets back from processing vital records. And working with the state, we will be receiving $1 more than the state. So it was reversed. The past, they have it, so we just want to make sure that we'll be able to cover any expenses here as moving forward. So that is currently in the rule process, and once that's complete, they'll be brought towards the counties in the state. So just I wanted to put that out there. Over the last 2 months, there have been 2 measles cases within Arizona, one in Maricopa and one in Coconino. Maricopa has closed out their case, and Coconino is still going through the process, and we were notified last week that there was an exposure event in Clark County as well with high exposures. The biggest thing that we're seeing, and we're going to work with our providers, so a health alert network was put out 2 emergency rooms in urgent care, but in each of the cases, both in Maricopa and in Coconino, the patients were misdiagnosed 3 times. They went to the hospital 3 different times, and each time they were not diagnosed with measles.
Wow.
And took them 3 times. And it's really common. It's just not something that's part of a differential diagnosis for most physicians. And they see a rash, they see conjunctivitis, they see minor symptoms, and that's what they focus in on, not realizing that in their mindset, oh, I should think could this possibly be measles?
It's been so long since measles has been a problem.
Has been around, so now it's slowly coming back. And so sometimes it's not the first diagnosis that they go towards. So we're gonna, nursing is currently meeting staff and, how to respond and preparing in case there is an incident here, but also working with our providers so they have that education to think about that differential diagnosis. And that would conclude just a brief report of those issues I wanted to bring towards the board. Thank you.
Okay, thank you, Dr. Kinsley. Okay, so at this time, I would entertain a motion to approve the minutes for the February 26th, 2024 meeting.
So moved. Litz.
Thank you. Do we have a second?
I'll second.
All those in favor indicate by saying aye.
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 Any opposed? Nay. Okay, the minutes are approved. We'll go on now to our regular agenda. We have a discussion of possible action regarding the January through March 2024 Board of Health Community Disease Report from the Public Health Epidemiology and provide guidance as necessary. Good morning, Anna.
Good morning. Those don't look like my reports. So hopefully you have a copy of the communicable disease report that is the first 3 months of the calendar year, and it's what we normally come up with there. So there's a case count of the reports that come into us, and then a case count of the confirmed and probable cases for that time period. And you've got a comparison between the same time period in 2023 and 2024, and then the 5-year median. And I think the only 2 things that I would point out there, COXI, the valley fever, which always comes up, and I know has been recognized in previous meetings that there's a higher number of counts out there and rates this year compared to previous years, not just in Mojave County, but also in Arizona. And you look there, we're about double what we had last year for this time frame in terms of the case counts, and that matches what Arizona is seeing. So exactly why, don't know, but keep an eye on things there. For a little bit further information, since there's always lots of questions on there, I did look at rates for different areas of the county, just using those 57 cases that are reported to us. The only place that had no cases reported was the Arizona Strip. So during this time period, of course, we'll get cases during the year, but none during this time period. I'd say the lowest rate, I think, is probably safest to say, as far as being reported to us, is Lake Havasu City. In the other areas, it's pretty comparable. There's cases out there. We always have cases. We don't know exactly what it means and where it's coming from. We have plenty cases out there, but nothing compared to what Maricopa and Pima and Pinal County see. That's the supposed Coxie belt. So keep an eye on things there and watch and see where they're coming from and see if there's any patterns or anything along those lines. Hepatitis B, the case counts are down from what we normally see, but we're talking a handful, maybe 5 cases during this time period on a normal given first 3 months, and we've got fewer this year. I don't know what that means. Maybe the reporting isn't coming through like it has in the past. I don't know. But that's the only other thing that seems to be significant there. If you want to point out RSV, the respiratory syncytial virus down there, our counts for 2023 and for 2024 are far higher than the median. But we have to remember that during COVID, basically, we weren't testing for RSV. We weren't getting reports of RSV. Those numbers were almost nothing. And even prior to COVID, there wasn't the level of testing for RSV that we have now. A lot of times you'll go into a provider now and you might be tested with a test that tests for influenza, RSV, and COVID. So of course we're going to dig up more cases there. The flip side there of the report gives you an idea of the respiratory virus season. And as usual, our peak was probably sometime around the holiday season. So we always say starting Thanksgiving, numbers are going to go up, and then they tend to go up through Christmas and the New Year's. But indeed, this year, that holiday season is when we saw most of our respiratory virus cases as well. So that's the influenza, RSV, and COVID. And the other things that we have mentioned on the back there, Chad already gave a nod to the measles and the fact that measles is in the news, and it's also on our minds in terms of public health because there seems to be an increase in cases throughout the world and also in the United States. And Chad pointed out a lot of the important points there, but there have been cases here diagnosed in Arizona, both in Maricopa County in Coconino County. And the point that I really wanted to drive home here is that measles is a big deal for public health, especially if we were to get a confirmed case. It takes an awful lot of resource, an awful lot of energy. You have to, it's an urgent situation. We need to get out there. We need to isolate folks as quickly as we can. We have to trace their contacts, and then under certain conditions, we would want to do passive surveillance with those contacts and keep in touch with them and see if they develop any signs or symptoms. We would want to do a whole lot of education with the providers and whatnot because, as Chad said, it's not on their normal list of things to consider there. And it's really tricky because most providers have never seen measles. So once it does get in the news and does start getting onto their differentials, then it can become a little bit more confusing because now they've got somebody with a rash and it must be measles. And so, there's a whole lot that we have to work with that. And as far as schools are concerned and whatnot, if you had a case of measles in a school, there is a good chance that we would have the schools on top of their vaccination records of all the staff and the students, and possibly going so far as excluding unvaccinated children from classes for 21 days past their last exposure. And so we're talking things that would probably be a big deal, and you can imagine what types of pathways we'd have to go through, and it would be tricky and difficult. So if measles were to show up, we would have a lot on our hands, and we would be really busy with the health department. And the only other thing there to mention is that mosquito season is back upon us. Technically, all year is mosquito season, but it starts to ramp up, and at least our activities in terms of trapping and testing, they ramp up right now in April, and they'll carry us through October certainly, and I think if we have the people and the resources through November. and we'll start watching the mosquitoes, looking for what types of mosquitoes we have, and testing some of those mosquitoes for some of the arboviruses that they could be spreading. Any questions or comments?
Yes, go ahead.
I noticed the RSV numbers keep going up as time goes by, and I'm curious, is there any evidence of causal linkage between having had COVID-19 and your ability to contract RSV?
So I can look into that. I have not seen anything that suggests that. I think the increases in numbers, firstly, RSV was something that didn't used to be tested except for on infants and children. And then it wasn't until it was before COVID, but I'd say maybe 5 years ago or so, we started testing older folks because we started to see that RSV indeed is making older folks sick as well. So part of what happened in terms of those increase in numbers is we only used to look at the children. And in some cases, we would only look at the infants because they're at the biggest risk of having the worst outcomes. So now we test older folks, and lo and behold, yeah, more people have it. So we get more numbers. And then, as I alluded to, you can have tests now that have come out that are very popular in clinics where one test will test for the flu and the COVID and the RSV. And it's that point of if you go looking for it, you're going to find it because it is out there. But to address that specifically, I have not heard that. Maybe Dr. Nguyen has heard of some research or some data that is evidence of that.
Yeah, I agree with you. Most of it right now are theory, just like you described. Another theory is that during COVID, we actually wear a lot of masks. So we actually don't expose to the RSV virus as much. So now we go back to normal life. It is heightened because now we have to deal with building up our immunity. And I agree with you that is mostly a theory. And yes, we never test RSV in the adult population in the past. Now we do, so we see a lot more.
If I come across anything like that.
Thank you.
It was also one interesting thing about during COVID is that when we were heightened and we were doing physical distancing and wearing masks, we didn't have a very strong influenza and RSV during the holidays. It was very low. And then when mask mandates were pulled back, we had an RSV in May, which is not as typical, but we had the numbers skyrocket. So it was interesting just to see. It was kind of a testament a little bit to what physical distancing and correct masks that are effective. You know, there's different ranges of their effectiveness. But what that did for society, we saw during the typical season influenza and RSV, the numbers very low until those mask and physical distancing changed and we kind of went back to that normal. Then we saw those numbers go up. So there was some correlation there, not so much of are you more susceptible to COVID for having RSV, and then also the increase in technology on testing on those points. But that was a very interesting point that we saw in public health, so thank you.
Okay, thank you. I have a question. We've heard a lot in the news about this this Colorado River parasite called liver flukes and how it's very dangerous to dogs, but it also causes infections to people, skin rashes. And so, do you have any information on that for the public?
I have, at this point, all I have seen has been what's in the media as well, and just out of curiosity, I did look into it a little bit. So I don't have a great deal of knowledge or insight into that. But yeah, I can make some considerations for next time to look into that.
Yeah, if you could research that and maybe present some information, because, you know, the warmer months are coming up and a lot of people are taking their pets to the rivers to go boating and swimming. Okay. Any other questions or comments? Hunter?
I have one. So in the last 4 weeks or so, we've seen a ramp up of some rhinovirus, and I know allergy season is on us, but it looks like, according to the chart, most, influenza, RSV, COVID, everything is on the decline quite significantly. I'm just wondering if county-wide we're seeing in the last month any types of other illnesses or any suggestion on why we're seeing our sick season extend later into the spring. It was kind of not like this in years past, so I'm just curious if this is specific to northern Arizona or if the county's seen anything similar.
So it would be tricky to say because the only things that we're getting the reports of are the influenza or the RSV or the COVID. And our main providers are out of the Kingman area, or our main reporters are out of the Kingman area, Bullhead City area, and then we do get reports from your clinics up there. So I don't know, because the only ones that we have reports of are the ones that they need to make reports to us over. But I can say that in order to get those types of diagnoses, usually you have to have that wider array, the PCR panel, that assay that's going to test for a whole bunch of, I think it's like 15 different respiratory viruses and respiratory pathogens. And I don't know how to address that for different organizations and what actually is going to get one of these reporters or one of these facilities to check a person and see what they might have on that full panel versus just a quicker little test. So it's another one of those, if you're looking for it, then you're going to flush out some of those other viruses that are making people sick. And I can't speak to exactly what the thresholds are and why a hospital might use that panel. It's part of it. All I can say is in our statewide respiratory season meetings and whatnot, we haven't pointed out anything that's alarming along those lines. Yeah.
Any other questions? Anyone on the phone? See none, I'll entertain a motion to approve the Q1 2024 Community Disease Report.
I'll make the motion.
Thank you, Hunter. Do we have a second?
Second, Litz.
We have a motion and a second. All those in favor indicate by saying aye.
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 Any opposed? Okay, thank you. Next item on our agenda is the health activity report from January 2024 through March. Dr. Kinsley, I think that's yours.
Just the monthly activity reports for our whole department, to see if there's any questions. If not, just to accept the activity of that. These reports are for the board members as well as your supervisors to review over. It pretty much lays out everything, all activities that were done by the department. It's on a monthly basis. It's tracked, and you can compare it to the year before, so you can see if a trend. And in future reports could be include multiple years to see if there's trends that are. It follows all reports. Like you can see that birth records are going down, or birth certificates. How many are issued? It goes from environmental health, how many how many restaurants were inspected last month. So it gives you a complete social media, every activity that's going on. So it's there for the board just to be able to review over, but since it's extensive, just entertaining if you have any questions. If not, just accept those activities for the first quarter.
Okay, any questions? See none, hearing none, I'll entertain a motion to approve.
So moved.
Do I have a second?
I'll second.
Motion and second. All those in favor say aye.
Aye.
Any
Aye.
opposed? Motion passes. Okay, now we'll be discussing the approval of the recommendation to the Board of Supervisors on amendment number 5 for contract CTR 050596 for the Health Start program with no change to the county budget.
Lynn Valentine can speak to this if anyone has any questions. This is part of the nursing services program. Or any questions for it. This is pretty standard coming forward, so.
Good morning. This is just an amendment for a one-year extension for our Health Start home visiting program, which is a program we've had for multiple years. And there is no change in budget.
Okay. I don't believe anyone has any questions. Do we need a motion on this to approve?
Yes, we'd just like to take a motion, so when we take it to the Board of Supervisors, the board's recommendation to the supervisors if they approve or not approve, so
Okay.
that we can just add that to the verbiage of the recommendation when we take it to the Board of Supervisors.
Okay, do I hear a motion?
I'll make the motion.
Second.
Motion and second. All those in favor say aye.
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 Any opposed? Motion passes. Next item is to approve the estimated cost of maintaining the health department and the monies from grants and donations for the annual FY25 budget as presented by staff to the Board of Supervisors. Good morning.
Good morning. As I get the presentation up, we'll get started. Thank you. Okay, so today we're going to go through our fiscal year 25 budget and what was brought to the Board of Supervisors last week during the budget discussion. There are going to be a couple of little changes here and there, and I'll go through those as we go through the presentation. Okay, so this presentation is brought to you by Arizona Revised Statute 36185A, which states that the Board of Health before May 1st of each year will estimate the cost of maintaining the department, and any unexpended surpluses from grants or donations will be taken into consideration to determine the budget needed to run the department. Our budget overview, the internal goal is to develop a fiscal year 25 budget that meets the community and department needs. We also want to ensure that we're fiscally responsible with all the monies that we are provided, whether it be from grants, general fund, fees, or donations. And then all of our grants, we have to meet whatever our costs are for each of those programs through the grant funds. So everything has to be fully supported by the grant itself. The exception is we do have registered nurses that work within some of our grants. So the grant pays for their salary, but they're not 100% supported by that particular fund. They're actually split funded among several programs and general fund. Quick overview, review from last year's presentation. We have 4 divisions. We have administration, environmental health, nursing, and nutrition and health promotion. In our administration division, we have vital records, which is our death and birth certificates. We have our behavioral health program, finance, which is where all of the billing occurs and the interdepartment transfers to ensure that we're getting the money that we need for our department. Public health improvement and accreditation, mental health first aid, youth mental health first aid, workforce training, public health emergency preparedness, epidemiology, which includes our suicide mortality review program and our child fatality review. And we manage the medical examiner contract. For environmental health, and this is overseen by our environmental health manager, Tara Stanek. Food safety program, public accommodations, including hotels, RV parks, campgrounds, school buildings, recreational health, so any public pools or spas, animal health, so our kennels and groomers, septic pumpers and refuge haulers, mosquito vector control, environmental health complaints and nuisance, and our smoke-free program, which is different from our tobacco program. Smoke-free works with the hospitals and, sorry, not the hospitals.
Smoke-free program works with the restaurants and any other public entities where food is being served to ensure that there's no tobacco use there. Nursing, that is Lynn Valentine, our nursing services manager. She oversees the communicable disease program, Health Start, which you all just voted on, HIV surveillance and prevention, immunizations, high-risk perinatal program, occupational health, public health emergency preparedness as it pertains to the nurse, school health liaison, STD family planning, tuberculosis control, and mobile health unit, which is our ARPA project, thanks to Supervisor Bishop. And then our nutrition and health promotion program, that's our last division. That's overseen by Brenda LeBou, the manager for that division. That encompasses Arizona Health Zone, Health, that's an error, Health in Arizona Policy Initiative, there's no Y in that. Maternal Child Health, Overdose Data to Action, Senior Nutrition Program, Tobacco Cessation, which is what Kelsey spoke about with the ASH line, and they help individuals to quit, and they also help youth to not pick up the habit. And then the WIC and Breastfeeding Peer Counselor Program. So that's everything that's being funded within our department. For our public health general fund budgets, administration is supported by general fund. The caveat to that is vital records. The fees for certificates are also a part of our administration budget. Then general nursing, and I spoke about the grants supporting some of those positions within general nursing. And then the tuberculosis control, so that's going to be any TB control. Is the mic back on? Yes, okay, sorry, it cut out. So any TB control activities, and it supplements, general fund supplements the funding that we receive. We receive, I think it's around $7,000 to run that entire program, and so general fund does help with that. And then our non-general fund, oh, sorry, I'm still on general fund. So our county nutrition program, the Division of Nutrition and Health Promotion is 89% grant funded. So 11% of that is supported by general fund, and it's only for the expense of, it's for 11% of what it costs to have a manager oversee that division, and it includes the computer, the phone, and part of the salary and ERE. And that is because that manager is not always working on any of those grants, and in order to bill a grant, we have to be able to tie that work directly to work related to that grant. And then senior programs, that is a non-mandated service. We continue to have it gladly, and it supports the congregate and home delivered meals for our senior population within Mojave County. We need at least 10% match, and in fiscal year 24, when we did our projections, there's going to be a 35% match from general fund, and in fiscal year 25, it's going to increase in its budgeted amounts. So it could change, but right now it's increased to 37% that general fund will support. The two that are not included on my slides, we do have a mosquito mitigation program that general fund supports with $25,000 every year, and that helps support trapping, larvicide, fogging when needed. And that is actually under what used to be our Zika grant. We had a public health emergency preparedness grant that funded those activities. When that grant went away, the general fund then started supporting those activities with the $25,000 each year. And then we also have a vehicle replacement fund for any of our Meals on Wheels vehicles. And that is, general fund contributes $47,286 to that every year. And we only use that fund when we need to replace a vehicle. So our non-general fund budgets, As I stated, it's majority grant funding, 33 different type of grants. Some of those grants have different programs within that grant, and so it's a total of 56 funding organizational codes. Our environmental health division is funded through permit, plan review, food handler fees, and a very small portion of the smoke-free grant. Occupational health is funded through a combination of transfer in from our risk management department and the employee benefit trust. And then, of course, our mobile health unit is funded through our ARPA funds through District 4. To look back over what our spending has been in the past, this is from fiscal year 20 through fiscal year 22, and you can see the majority of our funding has been through grants. That's going to be the largest bar there. That's followed with general fund, then our fees, then our transfer in between risk and our EBT. This is fiscal year 22 and 23. Again, the largest bars are going to be grants. The next bar over is going to be general fund. Then we have fees, then our transfer in from risk and EBT. For fiscal year 24, and this is our budgeted amount, this is not yet where we have landed, but this is where we project ourselves to be. The first bar is grant, the next bar is general fund. The next bar, the gray one, is going to be fees, and then our EBT risk management transfer in. It looks a little bit different this year, and there's several reasons why. One is because in the past we were receiving COVID funds. So fiscal year 20 through 23, we were still spending COVID funds. From the COVID funds, a lot of our grants became cost expenditure reimbursement. So instead of getting units of service, so you applied for this grant, we're going to give you $5,000 every month or whatever it might have been. Now it's they're reimbursing us exactly what it costs us to run that program. So that's why it appears that there's a decrease in grant. It's not necessarily that we've decreased our grant spending specifically. It's just the COVID funds have gone away. We don't have those to spend anymore. And then it's costing us less because we have vacancy savings. So it's costing us less to do those grant programs. We're not fully implementing some of those grant funded programs because we don't have the staff to do it. And so we're seeing a decrease in what we're receiving there. And then our fees are higher because both nursing and environmental health did a fee study this last year. And so we're seeing the fruits of that coming through. Now, our new software that finance did for our budgets creates these nice little pie charts. And so I pulled some of those. This demonstrates how much revenue we're getting, and it says by department, but it's really by program. So each of our programs are listed there. The biggest one is going to be environmental health. Again, those are fees that are collected. The next one is public health nursing. Then our immunization program, which is a grant-funded program. And then our women, infants, children. And then this is senior programs. So senior programs is an animal all to itself. So we do all of the budgeting separate from our other ones, and then it creates its own pie chart for the program. And you can see that Lake Havasu City has more income or more revenue, and that's followed by a Kingman. That is partly due to the increase of donations and in-kind that we receive from the Havasu site. The Havasu Site Council is very, very supportive financially for the program. Also, there's more meals served. So for both Kingman and Havasu, there's more meals served for both of those sites. And so we do have to put more grant funds, because this is partly state funded and general fund transfer in. So we put those funds in there to make sure the program's supported. And then we go into our expenditures. So as it is the biggest revenue maker, environmental health is also our biggest expenditure, and followed by public health nursing, and then health services administration. So the administration division is the third one for that. And then senior programs. So our Lake Havasu City site is, again, the largest expenditure. That is also because of utilities. We've seen quite the jump in utilities over the last couple of years, and all of our utilities come out of the 815 6312. And so that's one of the reasons why that there's an increase there. And then that's followed by Kingman, and then the Lake Havasu site under Title III, which is a grant that we receive. That's 100% grant. So our strengths, we continue to work on quality improvement. That's been ingrained in us since before we were accredited. We just make sure that whatever we're doing, we're continually trying to improve upon it. And we look at our processes continually also. We evaluate our staffing levels and job duties, and then we seek funding opportunities that fit within our strategic plan. And that would include obtaining more suicide mortality review funding, because we are going to be taking on La Paz cases in addition to the Mojave County cases. And then we wrote for a grant for substance use disorder. Also, we have a suicide prevention grant. It opened in December. Due to some issues at state, they had to close it. They just reopened it. So we do plan on applying for those fundings too. This is our strategic map. This is for 25 through 2030. And this is one of the things that we use to guide everything that we do. So our goals are improve health outcomes, improve maternal and child health, increase the presence of public health in the community, maximize tools and resources, and promote and protect public health. Looking at our staffing levels, because I did mention that's one of the items that we look at when we're developing our budgets. Mojave County did see a 1.4% increase in growth. We have 214,229 total population. We have 204,729 for our daytime population. Those are individuals that live and work full-time in Mojave County. That 214, they could be working in a state next door, like if they work in Laughlin or Utah or Mesquite. So using that information, I use the Public Health Accreditation Board's calculator. It's a staffing calculator that they have. So in fiscal year 24, we were funded at 79.96 FTE, so 79, almost 80 people. In fiscal year 25, we're putting in for 76, a little over 76 FTEs. Our recommended, according to the FAB calculator, is 74.8, so almost 75 persons. And our FTEs filled as of April 8th, when this presentation was created, we were at 74. So we're right in line with the recommendation right now. That saying, as things grow and more people come and more services are needed, we're going to. So our fiscal year challenges remain the same as fiscal year 24. So you've heard this before, but just as a reminder, increasing costs of materials, supplies, and utilities, recruiting and retaining of qualified staff, staff training. Language of proposed grants still continue to be of concern to Board of Supervisor members and some members of the public. So this is, I'm not going to go through line by line, but in our 212, so that's all of our general fund funded orgs, we saw an increase in internal services, and so that drove some of the increases that we saw overall to the budgets. And then what we put into our budgets for fiscal year 25. So we had a decrease of $75,579 in general fund transfer for our health administration division because it was decided by leadership to pull that from our contingency fund that we have. In our general nursing, which is the 2125103, there's going to be an increase in general fund transfer of $21,243. And that's for performance pay and the increases in internal expenses that I showed on the last slide. In our 2125104, that's our nutrition and health promotion general fund account. And we're decreasing it by $2,670 because those expenses related to that position will be transferred out to some of the other grant funding. And then for, again, our Zika account, we're requesting a continued support of $25,000 for mosquito mitigation. The one thing that is not included in here is that during the budget presentation that Finance did last week, they spoke of a 3% cost of living adjustment for all staff members. So everything that's within this PowerPoint and has been presented to you in the link with all of our budgets line by line, it does not include that 3%. And we only had two new initiatives. They're both related to senior nutrition program. During the last probably year, we have had some of our leadership going to our senior nutrition sites and doing everything from mopping floors to helping with meals to whatever was needed. And so it was determined that in order to make the program more sustainable, that we would need 2 additional positions. One, a site coordinator specifically for Havasu. Right now, we have somebody in Havasu, but they oversee all of the sites, and then they have to run the Havasu site. That is a lot for one person when they have to also do all the billing on the back end. So because of the grant, we have to track how many meals are being served, have to do food orders. Everything that's business related happens in the background, and that was a lot for one person to juggle. So what we proposed was to have one person dedicated to the Havasu site to free up that program coordinator to then oversee the entire program, but also to be afloat. So if somebody calls in, instead of the leadership of the health department going in, it can be that individual that's going in. The second position is going to be an office specialist that helps out the program coordinator and also fills in wherever needed, but can focus on the paperwork, the meal tracking and all of that also. And then both of these new initiatives were budget neutral. We figured out how to adjust our costs and use the grant funding that was provided from WACOG and ensure that there was no increase to the general fund. And on that note, are there any questions?
I don't see any questions here with the board. Is there anyone on the phone that has any questions? Great presentation, so I guess we're happy with it. I'll entertain a motion to approve the estimated budget for the Department of Public Health for fiscal year 25.
So moved, Litz.
I'll second.
All those in favor, say aye.
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 Any opposed? Okay, thank you, Melissa.
Thank you very much.
Okay, we'll now go on to a discussion about the Arizona State Bill HB 2042, the Food Cottage Bill.
Good morning,
Good
Madam
morning.
Chair and board members. Let me see if I can stop sharing that.
So this presentation will include the information about the Arizona food cottage industry and its recent expansion through House Bill 2042, which goes into effect once the 2024 legislative process is done.
Yes, correct. Thank you. So as Supervisor, Madam Chairwoman Bishop said, we're going to be talking a little bit today about House Bill 2042 on cottage food and the sale and preparation thereof in Arizona. So I thought we should start first with a little reminder of the department's vision of healthy people and healthy communities, which we work to accomplish through our mission in promoting, protecting, and improving the health of our communities. In no small part, we're able to do these things because of the public health powers and duties provided both in statute and in rule. So Arizona Revised Statute Title 36 establishes some of the laws for public health and safety. And as they relate particularly to this topic, they assign the powers and duties to the Director of Department of Health Services. They prescribe a duty to make and amend the rules for the administration and enforcement of laws relating to public health. And specifically, they require that measures be established to assure that all food and drink is safe from contamination and disease-causing organisms. It also wants to govern the production, processing, labeling, storing, handling, serving, and transportation of food. It's also there to provide minimum standards of sanitation and provide for the inspection and licensing of the premises and vehicles used in the commission of food service and sales. Let's see, where am I? So these measures are established through the rules that are created by the Arizona Department of Health Services, or ADHS, and are codified in the Arizona Administrative Code. So the Administrative Code defines a rule as an agency statement of general applicability that implements, interprets, or prescribes law or policy, or describes the procedures or practice requirements of an agency. So the Environmental Health Division operates under delegation from ADHS as the regulatory authority for food safety and sanitation. The delegated powers, functions, and duties include, among other things, the permitting and inspection of food establishments. The code provides definitions for both food establishment and foods. So food establishment is an operation that stores, prepares, packages, serves, or vends food directly to a consumer or otherwise provides food for human consumption, whereas a food is a raw, cooked, or processed edible substance, ice, a beverage, or ingredient used or intended for human consumption. So even while there are prescribed rules for food safety, we know that there are exceptions to every rule, and in this case, these come by way of exemptions for either certain foods or by what qualifies as a food establishment. Now, in the administrative code, potentially hazardous foods are mentioned quite frequently, so I thought it important to list the definition of what a potentially hazardous food is, and that's any food that requires time or temperature control to limit pathogenic growth or toxin formation, any animal food, raw or heat treated, any plant food that is heat treated, cut, or consists of raw seed sprouts. Now, some of the exemptions include whole fruits and vegetables. There is an exception to this. Fruits and vegetables may be cut if they are from a school garden or in a child care facility if they are washed and cut on site and served for immediate consumption. Commercially prepackaged food and drink that is not potentially hazardous. So this is going to be things like chips, pretzels, nuts. Another exemption is culinary schools that serve 15 or fewer students, and if the students are notified that the kitchen is not inspected by the Public Health Department. Another exemption is employee-conducted functions. So these are going to be like award ceremony, anything that's not regularly scheduled and is less than 4 hours in duration. Another exemption is non-commercial social events. So that'll be things like your potlucks. So moving on to non-potentially hazardous foods that are prepared in a home kitchen and for occasional non-commercial purposes. So this would be like a school bake sale or the bake sales that are conducted by the senior center do not need to be permitted and inspected. And lastly, non-potentially hazardous cottage food prepared in a home kitchen for commercial purposes. So let's look at Arizona's current cottage food program. So in 2011 and amended in 2018, the legislature changed the law to allow residents to prepare non-potentially hazardous food in their homes for commercial sale. And it specifically defines a cottage food product as a food that's not potentially hazardous, as defined by the department, and is prepared in a home kitchen by an individual who is registered with the department. It does not include foods that require refrigeration, perishable baked goods, salsas and sauces, fermented and pickled goods, meat, fish and shellfish products, beverages, acidified food products, nut butters, or other reduced oxygen packaged products, and that would be like beef jerky. So the requirements of the cottage food program are that the individual register with the ADHS for cottage food, and they have to renew this registration every 3 years. If they are operating at a temporary event, such as the state fair or a carnival, they would need to display their registration certificate. They also must complete an accredited food handler training course, and that also must be renewed every 3 years. And they are to prepare only approved foods, and those are listed below, and only in the registrant's home kitchen. And finally, they must package and label the product at the registrant's home to meet the labeling requirements. And some of the labeling requirements are, it must include the date that the product was produced, the registrant's number with ADHS, all ingredients that were used in preparing the food, and the exact statement that the product was prepared in a home kitchen that may process allergens and is not subject to health inspection. And if it's a product that's prepared in a facility with individuals with developmental disabilities, it must state that as well. So HB 2042 revises ARS Title 36, Section 136. And essentially it expands the foods that meet the cottage food exemptions and creates some additional program guidelines. Now, a similar bill was presented last year and passed both the House and the Senate, but was vetoed by the governor. And this year it also passed the House and Senate and was signed by the governor on March 29th. And we're gone. And we're back. So let's look at some of the changes to the program under this bill. So first, it expands the foods that meet the cottage food exemption to include those that are not potentially hazardous if exempt under federal regulations. And this would include, for example, the 1,000-bird exemption, where somebody perhaps that raises chickens, they're permitted to slaughter and process up to 1,000 per calendar year. Another is that it authorizes the sale of cottage food products that meet federal regulations or are from an inspected source pursuant to federal law. So an example is you buy some beef at the supermarket that's been inspected by the USDA and use it to make your tamales. It also specifies that alcoholic beverages, unpasteurized milk, and fish or foods that contain them do not meet the definition of a cottage food product. Some definitions that were added were the home kitchen, which defines a home kitchen as a residential home kitchen of 1,000 square feet or less, or a kitchen in a facility for individuals with developmental disabilities. It also defines what is a third-party food delivery platform, and that will be an online business serving as an intermediary between consumers and food facilities. So for the sell and delivery, it adds some additional labeling requirements. These additional requirements include listing ADHS's web pages where the consumer can go through and verify the registrant's or the preparer's registration with ADHS. It also requires that they list the sites where they can file a foodborne illness complaint. It also requires online cells to provide notification, those similar to the labeling requirements. So the date that it was produced, the registrant's number, all of those same things that are on the label must also be on any websites. So for sell and delivery specifically, cottage foods that are not dairy or contain meat or poultry may be sold and delivered to the consumer by the preparer or their agent, including a third-party vendor or carrier. The foods that are dairy or contain meat or poultry must be sold and delivered directly by the preparer. Additionally, cottage foods that are potentially hazardous are to be maintained at the appropriate temperature when transported. They cannot be transported more than once or for longer than a 2-hour period. Another requirement that is listed is that third-party vendors selling cottage foods, so say it's in a mini mart, that these foods must be kept separate from other products with signage that the product is homemade and not subject to licensing and inspection. It states that a cottage food product may not be used as an ingredient in food sold at retail or include marijuana or its byproducts. And lastly, it stipulates that a home kitchen cannot be used as a commissary for the purposes of a mobile food vendor. So a little of what we know and what we don't know. So we know that we have a law with no rules. We don't know the time frame that ADHS is going to be given for the rulemaking process. We know that rates of foodborne illness or injury will likely increase. We don't know what burden this is going to have on health and the healthcare system. We know that this law does not impede ADHS from investigating foodborne illnesses. We don't know what role our local health departments are going to play in assisting ADHS. We know that there's an absence of verification practices for program requirements. We don't know who and how compliance is going to be verified. We know that enforcement activities are largely going to be complaint-driven. What we don't know is who's going to bear the burden of responding to these complaints. We also know that this does not affect any other county or municipal code or ordinance. But for example, we don't know what effect this is going to have on wastewater systems and water treatment facilities from fats, oil, and greases because residential home systems weren't designed in the same way that commercial home systems are built to help eliminate those things. Ultimately, we don't know what we don't know until the rules are made. And we don't know what we don't know until we start to encounter the different situations and scenarios that are inevitable with this new law. So with that, thank you, and see if you have any questions.
Okay, I think there are lots of questions, but mostly questions that can't be answered at this point. You know, it's learn as we go along with this one. Do we know who will be inspecting these home kitchens at this point?
It's my understanding that they're not going to be inspected, that they won't be inspected. I know certainly the local health departments aren't going to be inspected. I don't know if ADHS has a manner by which they're going to maybe audit the registrants, maybe having them submit paperwork, for instance. So one of the requirements is that they use meats that are from an approved source, but how are they going to verify this? are they going to maybe randomly audit people that ask them to provide their receipts and proof of evidence of purchase? I don't know. So, but there are no physical inspections at this point.
Okay, I guess we'll just learn as we go on this one.
It was also discussed, so it's someone's private residence, and county officials, we wouldn't be comfortable sending anyone into somebody's private residence without, we don't know if that's search and seizure. There was a lot of legality to it and questions that were really, our hands are tied on it. So we had a lot of concerns on those points as well, and how it's going to be utilized. So like you said, it's going to be a process. And also, what mobile units and other, how are those going to be affected? And then also one point for all of this is the responsibility of the consumer. That's going to also, they're going to have to recognize that the label that they're buying, they're trusting somebody, and if they come to us, then ultimately our answer just might be, it was your decision to purchase that and consume it, and it's out of our hands. So I don't know if it's the best situation overall. Food Cottage does have its place, and it's important within our community, and especially for those, it's always been part of most cultures. But there's a lot of risk here, but we're going to have to watch how it evolves. So.
Okay. Any other comments or questions? Okay, I don't believe we need any action on this, so thank you very much for that presentation. And now we come to the point that we have not been looking forward to, hearing from Dr. Chad Kinsley, who has given his letter of resignation, which becomes effective this Friday.
Yes.
And I believe we'll be having a little recognition of you this afternoon up on the mezzanine. So yes. What do you have to say about this, and why are you leaving us?
I have been offered a position in Northern Nevada Public Health that really came down for my family and its future, and it's a very bittersweet move, and I've highly appreciate my time, and I want to commend the staff here. They've been amazing, and when I came in, they were performing excellently, and I would say that as I leave here too, that they will continue that excellence, and they are really the driving force that keeps all these points that we talked about today to protect and to preserve the health of Mojave County, and that's what the staff is there focused for. And you can see the great work that they're doing from all these different points and from all these different angles. So I want to commend staff as well as community-based organizations and those that participate in them. And thank you for the opportunity that I had here, and have learned so much, and will continue to definitely always participate where I can in here, and look forward for the great success that will be happening here in Mojave in the years that come. So thank you.
Okay, thank you. You came to us during a very difficult time for Mojave County, and we appreciate what you did to come and pull the health department together and make changes and improvements. And we're a better county because of the time that you spent here. And I, for one, appreciate everything you've done. I appreciate the way you handled all of the beat-ups and the criticisms and the kudos that you've gotten over your time here. So I think you'll be successful no matter where you go. And tell us what the succession plan is. How do you see us going forward?
And you brought up one point before for succession, but just want to acknowledge that the Board of Health, where it's come and been here, and I do count that as one of our collective successes here with the Board of Health, that during a contentious point on immunizations, that during that board, the Board of Supervisors was able to say, well, let's turn this over to the Board of Health. That's exactly what the Board of Health is meant to be here, and was able to discuss it and bring back information to the Board of Supervisors. And I want to commend each board member for that and the participation in it. And it was just exactly what a Board of Health is supposed to do here as defined. Succession, so my last day will be Friday, so at that time those responsibilities, authorities, and mandated services will be overseen by Melissa Palmer, Assistant Health Director. I do believe that Mojave County has opened up the position for recruitment, and that will continue through the normal process that is followed for recruitment. So during that interim and that time that they seek a public health director, all rights and responsibilities and mandates will be transferred to, as I said, Melissa Palmer. So.
Okay. Thank you, Melissa. I appreciate you stepping up again.
And any other questions?
I just want to second what the chairman said with regard to your performance here, Chad. I was still with the county when you came on board, and I really appreciated the things you did when you came on board and taking control and standing up so well in difficult circumstances. I really admired you for that, and I appreciate all you've done for the county, and I wish you all the best.
You're welcome back anytime when the next rabies case. So.
I remember that.
Okay, with that being said, then, I believe I will adjourn this meeting and say farewell to you, Dr. Chad, even though you'll be here for the rest of the week. This is the official see ya.
Yes, thank you.
Good luck. This meeting is adjourned.